question is that the bill be read a second time. The honourable member for Bowman.
Deputy Speaker, this is an important debate about the health care of this country. This is an important debate about whether you invest $692 million in non-service providing expenditure. This is a debate about whether, having set up 10 authorities in health, you set up an 11th one. This is a debate about just how much focus you can place on the back end, fiddling with the structure of our health system without putting any skin in the game at the front. And, Deputy Speaker, this is fundamentally about how much money is ripped out of service provision in order to fund this government's dalliance with setting up more authorities and spending more money on layers of bureaucracy, Deputy Speaker, that once was actually done by something called the Department of Health. Deputy Speaker, I can understand that the more consultants one employs, the more you need a panel to monitor them, that in turn is watched by committees, that in turn is guided by councils and is ultimately answerable to authorities one after the other. And I can see good reason from the left side of politics to simply generate more and more of these layers and call it transparency. I can understand why, ultimately, when you are trying to guarantee more outcomes and a floor in outcomes, that in the end you simply need more people watching the system to achieve that. And I can see, from where those people come from, why that is so important to them. But this debate is also about whether we are prepared to turn our health system around and put the patient at the centre of that experience, about whether we are going to unlock resources and make them available to the clinicians on the front line that know how to make the system work better but are currently disempowered to do so. And, Deputy Speaker, today's debate is quite simply about how far we are prepared to go before we have a system that is completely out of balance, with a focus on bureaucracy and not enough on the patient. The second part of what I want to say is that there are actually truly important things to be focused on in health policy. But this is by an administration, Deputy Speaker, that spent not $1 and not 1 cent of the stimulus package on health. I mean, if health care was something truly important, tell me exactly what in the stimulus package, Minister, was spent on health care and what proportion of it was spent on health. Now, you will always have a procession, Deputy Speaker, of government MPs from both sides when they are incumbent in government saying they're spending more than their predecessors, but that is not the debate. I mean, healthcare is growing, and Australia's expenditure on health is approaching 10% of GDP, and every administration will claim they spend more than their predecessor. No, this is the debate about just how many layers of bureaucracy a system needs to work. And at some point, Deputy Speaker, we have to say that is enough. I mean, I can understand you may wish to continue the important roles of many of these commissions and councils, but we also need to ask ourselves how big they have to be. Deputy Speaker, this is not a debate about the ends. It is a debate about the means with which we get there. And if I go through the $118 million over 4 years on the Health Performance Authority and go through the other 9 authorities that have been established, and I'm not even including those that already existed and are being continued, at some point we have to say, is that the best way to spend the money? And you only have to look at the budget, the cold, hard reality of every budget, to see the context in which these authorities are being set up. It's simply by ripping money off service providers. It's simply by building less Indigenous health infrastructure. It's about removing money from important things like delivering public and preventative health care. So let's go through it. I mean, I'm not giving you this data. I'm reading this out of the budget papers, Deputy Speaker. Okay, $3.3 million cut from substance misuse programs, particularly in Indigenous Australia, where if there's one thing you ask people in Central Australia most, it's where are the support services for those who need it most. $68 million cut from health workforce programs, $75 million cut from Indigenous health infrastructure. I mean, this is the currency that builds these new authorities. Now, I'm not for a moment going to say we don't need a system to get the Commonwealth and states working together, but I'm criticising the size, the mechanism and the delays in which it has been done. I'm criticising the fact that there has been a complete focus on this back end of the health system by an administration that's lost sight of the front end. There is effectively no communication with rural doctors about ways to retain rural doctors in practice, about the reforms around geographic classification systems. This is a government in denial. So I say simply, Deputy Speaker, what we need to be doing in Australia is picking up what is truly on the forefront that's going to give us a cutting-edge health system, as we're seeing in other nations around the world who have freed themselves up from this almost puerile debate about the fact that there's no role for private health in medicine. I mean, Europe has effectively moved on from that debate. We have no movement whatsoever on workforce productivity, no action around the Productivity Commission reports. The reality is that in public radiotherapy in this country, you will wait 10 weeks on average for treatment because you don't have private health insurance. But no movement over there to fix that problem. No movement from the Commonwealth. No movement, the fact that they have 21 public health staff per linear accelerator in the public system and around 11 to 12 in the private system. No answer to that. Around mental health, they've been dragged kicking and screaming to a solution after leaders from mental health forums even had to resign their positions to get some action from this government. On the big areas of time to commercialisation, pharmacogenomics, the need to have companion diagnostics to have more efficient prescribing, none of that's being addressed and massive savings exist. And of course, in this proposition of workforce, we simply have Health Workforce Australia with, let me be honest, a considerable amount of money that is working slowly through the modelling process to find solutions to particularly regional and remote Australia, providers practising at top of licence, and making sure we're providing the workforce that we will need in decades to come. Now, at the moment, we have deficits with doctor numbers, deficits with nursing numbers, and really no other answer from this government except we'll train more. That's right, we'll simply turn the taps on and hope they end up in the right location. I mean, this is the product, Deputy Speaker, of focusing on the back end, where you take everyone's job, make them insecure, cancel the divisions of general practice, throw it all up in the air, and what do you think stakeholders do? They're completely panicked about where they'll be next. They've got no idea whether they'll get a little share of the Medicare local pie. And you know what they do for 2 or 3 years? They stop criticising the government. Okay? They grab one-page press releases and say, what are we going to do? How does my job survive? How can I make this system work that's been imposed on me? And that's understandable. But I have always said that health, being probably the most complex system run by a government, reform of that is a privilege that is earned. It's not an automatic right of incumbency. But this is a government that did nothing except talk about a takeover and then not do it, come up with a plan that states rejected, and then, in this period of absolutely, desolate despondency in a government that is completely and utterly distracted from the main game, we actually have these dalliances with truthfulness, like the former health minister who said, we don't want to increase the size of bureaucracy. It's not appropriate for us to establish a health authority where there is not a need to do so. There will need to be people who can process essentially the checks that need to be paid through to local hospital networks, but it doesn't require an authority. I rest my case, Deputy Speaker. The former health minister said that, and yet here we are today consuming valuable time that could be finding solutions for remote and Indigenous Australian health delivery, but we are not. Why not? Because the price of setting up these administrations, Deputy Speaker, is removing money from the Cape York welfare reforms. That's right. New ways of looking after children, identifying those highest at risk, the DI model of education to keep kids at school, not just once in the morning, but all day, enjoying school, staying at school and graduating school. No, that money gets ripped out to do what we are debating today. The 11th authority. It's like you get one thrown in when you come up with 10. I mean, we're quite happy to come down here and talk about the importance of these reforms, of jurisdictions working together. But you read a set of budget papers and there's 38 employees. You read the next budget paper, there's 138 employees. Deputy Speaker, I don't want this to be a flippant comment, but once there was a Department of Health to do these things. Now, I don't mind us finding smarter ways to do things, but what we are doing here is the lazy approach. It's more layers, more levels, no necessary agreement from our state colleagues on the way this is being done. And when the political obituary is written of this government, they will say in health that they fiddled with the back end but never took the hard yards at the front, because it's a government quite happy to fiddle with financing, as they do around school reforms, but they're not looking at quality. I mean, the one thing that a government can do is focus on quality of care. Have there been any reforms around practice incentives? No, just move the bar higher to save a few quid. Have there been any reforms around chronic disease management so that we get guaranteed outcomes, Deputy Speaker, when a patient comes to a GP? No, just keep paying the money, and I thank you for your guidance. No, just keep paying out the money without any guarantee of quality outcomes. I mean, You've been incumbent now for 4 years. I mean, it's time now to take some responsibility for the outcomes of the health system and stop fiddling with the back end. Get your head out from around the back and come and live with a local remote nurse for a week. Come out and see chronic renal services being delivered in Central Australia in the Western Desert. Get out of Canberra, get out of the Beltway and start looking after local service providers. Free them up to unlock the potential of this great health system.